Hello friends, I am Dr Richa Malhan. I am a gynecologist and a first-time mom. Today I'm going to tell you what's in my delivery bag because I am also term. I'm 37 weeks today and all set for delivering the baby this month, and therefore I thought it's very important for me also to have a bag ready, and showing you this bag would help you also be better prepared for your delivery. Well, how many times have you thought that if you were a doctor or a gynecologist, you would know exactly what to do with your pregnancy and what to pack in your delivery bag, right? So a lot of patients have come to me with the same complaint, and they ask me for advice as to what to keep in the bag exactly. So that is the reason I have made this video, to help you all be better prepared what I am carrying in this bag so that you can carry the same things. Now my baby is not a millennial but a coronial baby. It's also coming in the end of June 2021, which is the corona pandemic period, and therefore I have also shopped most of the things for the baby online because going to the market and everything was not safe at this point. So in the description box I'll put the links of everything that I have bought online, so that you can also order the same things or look for the same things in the market if the pandemic is over by the time you're watching this. Now the second thing that you need immediately after you reach the hospital, say you have labor pains and you reach hospital in a lot of pains and you immediately deliver, or maybe deliver in a few hours, the first time you will open your bag and the first thing that the nurse will ask you for is your baby's clothes. So you should have a bag ready in which you have all the baby essentials. This is my bag, the bag that I'm going to give for the baby. When the sister says that she needs a towel and the baby clothes, then you should have preferably a bag ready, or maybe a section of clothes you should do, or your husband or any family member that you think will be accompanying you to the hospital should know that there is a particular bag. I kept it a shiny, golden, beautiful bag for the same, because then it's easier also for everybody to identify that okay, this gift wrap beautiful bag is for the baby and this is the first good news bag. So this bag should be ready. I'll tell you what exactly is in it. Now what's in the bag is, the first thing is the towel. This is a receiving towel made up of cotton or malmal cloth. Sometimes women like to go for 100% bamboo clothes. That's also fine. You can go all as natural as you want. Basically the cloth that you use should be cotton and soft for the baby. It should not have any kind of indentation that may rub against the skin of the baby. So the first thing is a towel. Second thing is the clothes. So I've chosen this cute little romper which has full sleeves and full legs. It has tic-tac buttons on top, very easy to dress the baby in it, and I'm expecting a slightly bigger baby from the scan that I've last gotten done. I'm expecting the baby to be somewhere around 3.5 to 4 kgs because now I'm term and I've just gotten an ultrasound done, so I have an estimate that the baby is going to be slightly bigger than a newborn size. But still, if the baby happens to be smaller, the second change is this one. So this one has a top and leggings. But what I've kept in mind is when choosing a top, it has strings right here. So I can like tie it with the strings. I chose something like this, which attaches like this and then the strings close if the top is closed. Either something like this or something with buttons. But please do not go for a top which has zips. What happens is the baby is going to have umbilical cord hanging from its abdomen. Okay, it's around 5 centimeters from the baby. The cord that attaches you and the baby, your placenta to the baby, that's going to be hanging for at least 10 days on the baby's abdomen. So you want to choose something that does not injure it. Therefore a zipper option is not so good. Always go for something that has buttons or strings attached. So this is the clothes. After that, you must always have something that covers the head of the baby, because the baby is going to lose a lot of heat, which you don't want that should happen. Okay, so to preserve the heat of the baby and the baby does not catch cold and lose all its heat, does not have hypothermia, you should have a cap and then mittens and socks. So mittens, socks and cap, these are 3 additional things you need along with the first dress that you give to the nurse. Additionally, when you buy a set, you might just get a bib or a handkerchief like this, or a burp cloth. You can keep all these things, because after feeding you may need some of these to wipe the baby, but these are not essentials. The essentials is a dress which is full sleeves, full legs covered, preferably string attachment or button attachment but not zipper, and then caps and mittens and socks to go with it. Now the first thing that comes out of this bag is a towel, of course, and then there are some small towels and handkerchiefs that you might need. The third thing that you might need is a dupatta or a shawl that you might want to cover yourself while feeding. So you can go for the ready-made fabrics that come that are cover-ups or kaftans that are there to cover up while you're feeding, or you can keep a dupatta like this. You can also have a shawl because it gets very cold in the hospital sometimes, especially after a cesarean section. You may feel very cold, and you must have a shawl like this in your bag. And secondly, I have some undergarments. These are all maternity wear that I've bought mostly from Amazon. These are all nursing bras that you can easily find on any of the websites that are like First Cry or maybe Amazon. All those websites have some kind of maternity bras that you can easily find. It's going to be much comfortable if you have these kind of bras than normal bras, and some underwears, of course. Next item in my delivery bag is the breast pads. You must carry a few breast pads with you, because in case you leak a little extra milk, it's just embarrassing that you've stained your clothes or the bra. So if you want, you can have some of these in your bag ready to just wipe yourself, or to just keep them inside your maternity bra so that you don't leak inside your clothes. Last and the most obvious item in my bag are these clothes. There's a pair of leggings and a very comfortable soft cotton t-shirt. There is a night dress. This is knee length dress. Why I've kept it is because when you're in labor you might be checked again and again. So something that's a little shorter, knee length or something, it's easier to kind of pull up and get yourself checked by the doctor again and again. Also, it's more easy breezy. You tend to feel very hot sometimes. So if there's a cotton dress and it's shorter, it's going to be better for you. Next up, I have this bag full of toiletries. This basically has some small pouches of shampoo, conditioner, body wash, toothbrush and toothpaste. That's about it. So these are the basic essentials. Then in case you need to change in the hospital, you're staying for a long time, you might need a pair of flip-flops. This is a random pair of flip-flops that I will be wearing in the hospital in case I'm not comfortable in the shoes that they give you. Now next I have these diapers in my bag. These are not one diaper, one size diaper, but multiple diapers. I chose pant style diapers. Some people want to go for diapers that are tie-ups on the side. Any is okay. I think the ones that tie up on the side are more convenient because you can like tie it a little loosely or tightly according to need, which is better, more convenient. But I chose pant style, but then I have 2 or 3 sizes right in here. Depending on the baby's weight, the newborn size might not fit. You might need a preemie size in case you're having a premature baby, or you might want a 0 to 3 month size in case your baby is larger like mine. So I have 2 or 3 sizes of diapers in this bag. There must be around 10 to 15 diapers at least in this bag. That's the maximum I suppose you're going to need. And in case you need more, there's always a chemist in the hospital to just randomly go and buy it immediately. Then I am a bit of a makeup junkie. Even if you're not, then sometimes you just want to take the first picture of with your baby, or when you're going home, you just want to dress up and feel slightly better. I mean, whenever I put on a little bit of lipstick, then it kind of uplifts my mood. So this has some basic makeup, which is lipstick and a mascara and an eyeliner. So these 2-3 things you need that should be there in your bag in case you're fond of earrings and all. So whatever makeup or accessories that you like, they're right in this bag. You can always have one of these in your bag. And the most important, the one thing that we all forget is the husband's bag. So this is my husband's bag. He only has 2 pairs of clothes in here. So his undergarments and 2 pairs of clothes, very comfortable shorts and t-shirts are right here. Just so that in case he's staying with you in the hospital, or anybody else who's staying with you, say your mother is staying, then maybe her clothes should be, at least 1 pair or 2 pairs should be in your bag, so that they're also comfortable in the night staying up with you. Then there's this random sanitizer, safety pins, scrunchie, and a lip balm. You must always have a lip balm with you in the hospital because your lips tend to get more dry while you're in labor and everything, because it's a more painful condition. You're sometimes drinking less water, sometimes the water may be stopped. In case you're having a cesarean, then they'll tell you not to even have water a few hours before the delivery, so you should have a lip balm with you so that you feel more hydrated. Last but not the least, you must be waiting. There's a bag for the baby also. I've quite well organized this bag. In this bag, what you have is a dryer sheet. You need one of these just so that in case if the baby is in the cot next to you or on the same bed also, even though the baby will be wearing a diaper, and the hospital usually gives you the baby in a diaper, they'll not give the baby to you in a cloth langot or something. So it's pretty safe. You're not going to get wet, or the baby is not going to poop on you, but still you should have at least one dryer sheet with you all the time. So I've kept one of those. There's a swaddle. This is a muslin cloth swaddle. You should have at least one or two swaddles with you so that your baby sleeps better. You can swaddle the baby up, and that is a more comfortable sleeping position for the baby, because that's the position in which they're sleeping inside your womb. So if you swaddle them up, they're going to sleep better even outside. So initial few days, that are transition period, these kind of swaddles are going to be very helpful. Then you can have some changes. So I have some extra pair of clothes for the baby. So I chose onesies. These open up from here, so it's easier to put the baby's bigger head into it. So always make sure when you're buying onesies, they should have something like this on top, which kind of expands. So it's going to be easier to put them on. If these are not there, then it's going to be very, very troublesome to get your baby into these dresses. So this kind of a space or extension should be there on top of your baby's clothes. I've also kept a relatively warmer outfit for the baby, and that's because if the baby's size is larger, then I think this is the biggest size that I have. One for that, and then it is a front open thing. It's very easy to put the baby in, and it's kind of woolen. So the baby is not going to feel cold. In case it's very cold in the hospital, I'll put the baby inside this dress. So you should have at least 3 or 4 pair of clothes for the baby, and they should be a little different sizes so that if the first dress that you carry doesn't fit, then you have other options. Make sure when you have these dresses, you wash them in baby detergent, or even random household detergent is fine, but you properly wash them and dry them in sun. You should get enough sun and air so that in case any bacteria is left behind, it gets cleared away because of the sun's heat in the air. And then after that, if you iron them, then the residual moisture inside any of these clothes will also be gone. So wash them properly and then iron them also, and then keep them in the delivery bag so that they're absolutely ready for use. Do not make your baby wear clothes from the market directly. Every cloth that goes on a baby's body should be washed beforehand. This brings me to end of the video. I hope you enjoyed watching it, and everything that I've kept covers all your needs also, and you're better prepared for happy delivery. So see you next time. In case you want more useful content regarding motherhood, labor, delivery, then you can always subscribe to my channel, and we will talk more of these, and you will get a doctor's perspective on things, which I guess is slightly better than any person who does not have much experience dealing with pregnant women will have. So I see women delivering every other day in the hospital, and the troubles they're facing, things they need, and counseling they need, the motivation they need. So I think I was better equipped for this, and I could help you. In case you still have some doubts, you can always put them in the comment section, and I will answer them as soon as possible.